study on midwives' attitudes towards the implementation of a midwifery continuity of care model prior to implementation at the Mater Health Service, North Queensland. Good afternoon, my name is Deanna Ward, and welcome and thank you for coming to my research proposal. For OHS, if you would like to just turn to your left, and through the doors is your assembly evacuation point. And also on your left, you've got your toilets as well. This research proposal is part of my Masters in Nursing, Leadership and Management. What is the midwifery continuity of care program? Midwife means with women. Midwifery continuity of care means to have a known midwife in every stage of a woman's pregnancy, birth and postnatal care. The program will give women choice in their care provider by giving women the option of having a midwife as their primary carer. The program will be targeting women who have private health cover but are choosing to have their babies in the public health system as they would like a midwife as their primary carer. The aim of the program is to give women choice, reduce the strain on the public health system and increase the number of women with private health cover to birth at the Mater Health Service, North Queensland. Currently, the Mater Health Service offers an obstetric-led model to its low-risk women. This model, as you can see from the diagram, offers some antenatal care, intrapartum care, and limited postnatal care. The pros of this model is that you have a known obstetrician throughout your care. The cons of this model is you really have limited midwifery care, which is why we want to make a choice for women by having a midwifery care model as well, which incorporates both midwives and your obstetrician if necessary. By providing the option of a midwifery continuity of care model, women have a choice. Midwifery continuity of care allows women to develop a relationship with the same caregivers throughout pregnancy, birth and the postnatal period. Women have a midwife caring for them during labour and birth whom they have met before and feel that they know, and this trusting relationship increases their confidence. The midwife would work within the ANMC Competency Standards for Midwives 2006 and would be able to refer the woman to the referral obstetrician if the pregnancy escalates to high risk. Midwifery continuity of care at the Mater. What does this look like? It would involve having a known midwife as the woman's primary care provider at all stages of her care. As seen in the diagram above, the midwife would see the woman antenatally, intrapartumly, postnatally and extended home visits. The midwife is able to tailor care that is appropriate to the individual woman and her family's needs. Consultation. The development of the project included at their time and assistance in preparing the research proposal. Jude Shaw, Education Coordinator, Joanna Peters, the Midwifery Unit Manager, who's also allowed us to look at this new model. Karen Gerard, she's the Director of Nursing and she's also on the Ethics Committee at the Mater. She's helped with the application. Dr. Cringy Cannon is supporting the model. She's an obstetrician. Karen Yates is JCU's coordinator and she's part of my Masters project, and she helped with the research proposal question and methodology. And Karen Beasley, she's a midwife in Sydney that's affiliated with the Australian College of Midwifery. She's a reviewer for the MPR and her interests include women's choice and continuity of care. Focus clinical question. The main words are identified through the literature review. Defines the inclusion and exclusion of the review. Defines the search strategy. Provides assistance for deciding on the primary research papers and helps with the collection of data. The focus clinical question. How did we come up with this? It was really hard to try and come up with a focus clinical question. It took some time and some thought into making exactly what we wanted. The research question is very important in giving us the direction of the research proposal. The The research question we came up with for our specific proposal was, what are the Mater Health Service North Queensland midwives' attitudes towards the implementation of a midwifery continuity of care model? We're basically looking at what are the midwives' attitudes. Were they going to be accepting of the continuity of care program, or were they going to disregard it? Because we want to give this program the best possible chance that we can. How did we develop the focused clinical question? Well, we spoke with midwives over lunch breaks, in the staff room, and even in birth suite, as we were unsure of their perception of the program. Was the perception going to be positive or negative? We were unsure how they would perceive this form of change in maternity at the Mater. So that's why we decided to do this research proposal, so that we could obtain information on the midwives' attitudes before we implemented the program, so that when we do implement the program, it can be managed as smoothly as possible and be successful. So the questions that we asked these midwives were: 1. Do you think the midwifery continuity of care model has a role to play in the future provision of maternity services at the Mater Health Service North Queensland, and why? 2. Do you think the implementation of the midwifery continuity of care model would affect your workload? And 3. Would you support the midwifery continuity of care model if it was implemented at the Mater Health Service North Queensland? Some midwives' responses. One midwife said, "That sounds great." So that was a good positive response. Another one was quite interesting, and it was about more workload. And this midwife said, "How would it work? We are already busy enough." So I thought that was quite interesting. Another midwife was thinking more from the obstetrician's point of view on if they would get a reduced clientele. This midwife stated, "What do the obstetricians think? Will this take away their patients?" And lastly, a midwife who was looking at it positively said this: "It's great that we are looking at giving women choice in the private health system. It's about time." So I thought they were all quite interesting responses, and that's why I thought this was a great research proposal to do, because really there's a lot of responses and perceptions that the midwife could have and attitudes towards this. So I thought this was the way to go. Search strategy process. So why would we do a literature search? The literature search process is used to identify existing literature related to the focused clinical question. This allows us to evaluate all the research that's been completed on the topic and allows us to justify the reason why our research is important. This process is important because it helps us demonstrate that we have the knowledge in the field of study and that we are able to prove that the research is relevant to our work. By performing a search appropriately, you are proving that there is a gap in the field of research that your research proposal could fill. Literature review. The databases that we chose were CINAHL and Medline. These are both health-care related databases. Our inclusion criteria included journals only, and the key terms used in the search was implementation of a midwifery continuity of care, attitudes, perceptions. Literature review. So after I did my search with my chosen key terms, I refined my search also and focused on midwifery attitudes and reviewed all the articles by title keywords. So I got down to CINAHL got 5 articles and Medline was 4 articles. So after critically reviewing the literature articles that we came down to, I found that I was able to clearly see that there was little previously work done on this topic, which is what we want because we don't want to repeat a subject. And the extensive list was narrowed down to 5 similar articles in total. So the one I found most interesting was actually done at the Mackay-based hospital, which was called North Queensland Midwives Experience with a Team Model of Midwifery Care. This was done in 2004. It was actually completed after an implementation of a new model, which was group practice at Mackay-based Hospital in Queensland. Now, it wasn't exactly what we're doing. It was focusing on midwifery attitudes, but it was after implementation. So we're actually looking at before implementation. So their recommendation, which I thought this was quite interesting, was the need for appropriate environmental scan and implementation of planning processes and team building before the introduction of any new model of care, and a shared governance to allow midwives to meet both organisational and professional goals. So I thought it was interesting that in their recommendations it actually says that you should do a planning process before the introduction. So that's what we're actually doing. So I feel like we're going on the right track by doing this research proposal. The problem statement. The problem statement gives a detailed description of the research problem and the importance of the study. It identifies what is going to be studied without using vowel-laden words. The problem statement is a clear and concise description of the issues that need to be addressed by the research team. It needs to be convincing to the reader that the study is worth doing. Is it relevant, and is it going to be useful to the midwives of the women's unit? It identifies key terms, words and concepts. The problem statement allows you to give a theological framework and methodology to your research. A good research problem has 5 basic characteristics. The problem must be significant enough to contribute to the existing body of research. The problem must be one that will lead to more research. It must be possible to investigate the problem through the collection of data. The problem must be interesting to the researcher and suit their skills, time and resources. And the problem must be ethical and not cause harm to others. The problem statement. So what's our aim? Well, our aim will be to define what the attitudes of the midwives are to the implementation of a midwifery continuity of care model at the MARTA. This information could assist in future engagement strategies and may also test if there is likely to be any resistance from staff to future releases. The problem statement. The implementation of a midwifery continuity of care model may be seen by midwives as a threat to the obstetric model rather than another care option for women to choose. The midwifery continuity of care model will interfere with their workload. So there are a couple of key problems that we thought might be an issue. Research methodology. So what does methodology mean? Well, it's the philosophical framework that underpins and guides the research process throughout the study. It also embodies a research approach and it guides the researcher in the application of its methods. So what research methodology did we choose for our research proposal? Well, after some thought and look at the different types, it's obviously a qualitative study. So the methodology that we chose was the post-positive method. Now the post-positive people accept that theories, backgrounds and knowledge and values of the research can influence what is observed. So this methodology will help with the use of our data collection, which obviously we're using questionnaires. So with a questionnaire, because it is a qualitative response and we're looking at attitudes, this method seems to work quite well with what we're looking for. Questionnaires for data collection, a cost-effective research tool used for data collection. Participants are all de-identified and no assistance required to complete. So we're just going to give it out at an information session, and not have names or anything on it, and then they can just pop it in a box at the end of the session if they choose to do so. It's not compulsory. Research methods. Sampling. So we were trying to work out how many of the midwives we would have to survey with a questionnaire, and I first worked out how many midwives we actually have in the women's unit at the Mater. So we have 45 midwives in the women's unit that will need training in the new model of care. We also have casual midwives which are included, which are 5 midwives because they are quite regular staff members, so we thought that it would be good to train them in the new model so that they're also aware of the model. There's a program on the internet called RayoSoft, which is at www.rayosoft.com, and it's a tool used that can give an expected sample size of what we would need to carry out the study. So I jotted in our numbers. So the margin of error is what you put is 5%, confidence level 95%, population size was 45 midwives, and the response distribution is 50%. So the recommended sample size is 41. And I think 41 will be an achievable number. It's obviously quite high, but I expect that we'll be able to have that number. Research methods data collection. So for our data collection, we have decided to use 2 methods for our questionnaires, and that's SurveyMonkey, which is an electronic data collection tool that's free, and a written data collection tool. So we thought with both of these tools, they can be anonymous. We can add the electronic data tool to information posters so that people know where to go to do the survey if they choose to do it electronically, all anonymously. And the questionnaires, we thought at information sessions on the new model of care that we would have the questionnaires there with a private box which they can choose to place their questionnaires into, which only the research team can get to. Very anonymous and no pressure. So the issues that I'm actually concerned about is that there's no bias or power struggles or influences, because we don't want people to feel pressured to do the questionnaires, and because I'm an educator at my employment, I didn't want people to feel that they had to do it because I was watching or anything, so it's very anonymous. The methods of data analysis, which I went over with RayoSoft, will be used with our questionnaires, and the advertisement for the data collection will be on posters that will go around the Mater Health Service, and the posters will say Midwifery Continuity of Care Program, and it will be an information session that they will be able to go to, which will also have our research project as a part of. Ethical considerations. An ethics application for a low negligible risk project at the Mater Health Service North Queensland using the Australian online forms for research, and an ethics application to James Cook University for approval prior to starting this research. Upon filling out these forms, I discovered that the research application that we are putting in is a low negligible risk. Risks identified. The National Health and Medical Research Council, NHMRC, National Statement on Ethical Conduct in Human Research 2007 defined a negligible risk in its guidelines as the research in which there is no foreseeable risk of harm or discomfort, and any foreseeable risk is no more than an inconvenience. The Mater Health Service Research Committee is registered with the NHMRC. Ethics consideration, recruitment and consent. So we're going to give this questionnaire out on a voluntary basis to midwives prior to the midwifery continuity of care program information sessions. So recruitment will be through the posters and their consent to do the questionnaires, and questionnaires will be anonymous. So the timeline. Questionnaires will be available to staff over a 10-week period, which will be at the information sessions, but prior to implementation of the program. So we'll have information sessions over a 10-week period where they'll be available. As the questionnaires will be distributed at the information session, this will determine the timeline for the data collection. Mater Health Service North Queensland timeline for research proposal. We used a table format for this research project. October, finalise research proposal. October to January, secure ethics clearance and approval. January to February, finalise print questionnaires and ensure electronic survey monkey is up and running in preparation. Posters to be finalised and distributed at the Mater Health Service. March to May, questionnaires to be available to willing participants. Commence data collection with dissemination, data entry tool finalised. May to June, data entry of returned questionnaires, paper and electronic. June to July, analyse the data. July to August, write up findings. September to October, finalise written report and send funding bodies and ethics committee copies of the findings. Dissemination of findings to the chosen journal, which we have chosen the Australian Journal of Midwifery. For the budget, it's going to be a low-cost research proposal. The research team is volunteering their time as they are either staff employed at the Mater, the JC facilitator, which is helping me with my master's research proposal, the obstetrician, who's kindly researching her time as well, and my resources. So I think my only cost will be the paper, which I've got a large estimate of $15 to do the questionnaires, and SurveyMonkey is actually a free use to use the basic electronic survey. So it's going to be a very cheap research proposal, so I think it's going to be very worthwhile to do. Dissemination plan. We want to distribute the findings of the research proposal to our funding body, which is the Mater. We want to distribute the findings to any ethics committees that were involved, make available findings to the women's unit staff, and disseminate the findings to our chosen journal, the Australian Journal of Midwives, which will contribute to the existing body of research. Thank you for your time.